Welcome, everybody. Welcome to Dr. Harry's Healthy Corner. This is where we come each week to talk about small changes that we can make that can help us achieve the best health possible. And by being healthy, it allows you to live the best life possible and pursue the things that you want to pursue. So, welcome again. And you know it must be 7:30 because here we are. Today's topic, I want to talk about high blood pressure or hypertension, as it's commonly known. So, before we jump right into that, for those of you who are bacon lovers, you might want to put your fingers in your ear because I want to talk about a little study that was actually picked up by CNN.com. And if you follow my Facebook page, you've already seen this one. And it talks about processed meats, such as bacon and sausage. And the conclusion that this study came to was that even one slice of bacon, which is a processed meat, can increase our risk of developing colon cancer by as much as 20 to 25%. Wowzers. That's a big one. Now, this was done for people who ate at least that much every day. And even this was even more so than those who consumed just red meats that was unprocessed. So the moral of the story is if you got to eliminate something, eliminate processed meats. If you must have bacon, try to have it as unprocessed as possible, and please avoid it every day. Okay, so hopefully that was helpful. Hi, Latina and Nadine. And so now let's jump right into high blood pressure or hypertension, as it's commonly called in the medical community. So what is high blood pressure? So I want you to think of high blood pressure. Many people, we think about numbers and we wonder, what is high, what is low, what is normal, is my blood pressure high? What happens if my blood pressure is high? What type of symptoms do I have if my blood pressure is high? And most importantly, what can we do about it? So let's start out simply. Recently, some changes were made in the numbers for high blood pressure, and believe it or not, the general consensus was that our blood pressure should perhaps even be lower than we've been thinking that they should be. So previously, 120, which is the top number over the bottom number, and we'll explain what that is, over 80 was initially considered to be normal blood pressure. Now that's being reclassified as pre-hypertension or pre-high blood pressure, which is interesting to note, right? So basically, the bottom line is we need to be concerned about those numbers, and I'm going to tell you why we need to be concerned about these numbers, right? So imagine that you have got piping coming to your house, right? And the piping, it allows the water to come in. It allows you to access the water when you turn the tap on. You can use your dishwasher. You can use your dryer, you can take a shower, all of those good things. Now that is basically a pressure system. So imagine this, the body has a similar pressure system, the blood vessels, the arteries. The primary difference is these arteries or piping system, they're very flexible. And so what usually happens is they can expand, they've got great elasticity, they can expand and allow the blood to flow where it needs to go. As we get older and with certain conditions, that elasticity becomes less and less. So the blood vessels now are not as elastic as they used to be. And so what happens when you put the same pressure through hardened or stiff arteries, then the pressure has to go up, okay? So that's primarily some of the things that's happening with high blood pressure. And if the pressure is too high in the system, then of course the pipes can burst or break, and that is very similar can lead to strokes, for example. And if those pipes and systems become too blocked off, then we can have heart attacks and also strokes. The high pressure in the brain can lead to some bleeding in the brain. So high blood pressure, basically, you want our blood pressure within really nice acceptable levels, because we want to be able to, one, make sure that all systems in the body are getting the nourishment they need, because the blood does take oxygen and it takes nutrients to all of our systems, and that includes the brain and the eyes and the heart. The heart absolutely feeds itself first before it feeds others, and it goes to the intestinal and the skin, and it gives you that nice glow. And so we want to be able to do that. And we want to make sure that the body is able to get enough nutrients. But if that pressure becomes too high, then complications can develop, because then that's too much pressure going into the organs such as the kidney, and that can damage it. Too much pressure going into the brain, going into blood vessels to the heart, and then that can start creating a lot of damage. And high blood pressure is often referred to as the silent killer or the silent disease, because many times we don't have any symptoms, and the individual or the person who has high blood pressure may not have any symptoms initially. The symptoms oftentimes come after the damage has been done, and that's why it's really important to know what your blood pressure is and to check that periodically. And that's one of the things that's done in your annual exam with your physician. So that's a little bit about what high blood pressure is. As the numbers start going high, we are talking about, you'll see the top number, that's called the systolic, and the bottom number is called the diastolic. And the bottom number really refers to the ability of the blood vessels to be able to relax, okay? And the top number refers to basically the elasticity when you're sending blood to supply the other organs. So ideally, you want your blood pressure to be less than 120/80. Now, that's not for everyone. Some people, based on body size and activity, that may be slightly different for them. If you have a history of high blood pressure, then you don't want to lower it too quickly, because that can create some issues as well. So the numbers that we're looking at, if your blood pressure starts being, for example, 130/80, that's a notification that maybe something needs to be addressed. And often the great thing about this is that those numbers, oftentimes lifestyle modifications can make a significant difference. Where many people start running into issues, of course, with blood pressures of 140/85 and 90. And believe it or not, these numbers can get significantly high, up to the point of crisis numbers, such as the top number or the systolic number being about 200, to the bottom number being 100. That is a super high blood pressure. That is something that needs to be managed urgently, because that can potentially lead to those pipes bursting that we were talking about. So just keep all of that in mind, okay? So what can contribute to high blood pressure? Like, what are some of the things that can increase our risk for high blood pressure? Well, we talked about aging, right? So that is something that, again, we are all super happy to get older, but some of the changes that can happen with aging can be what we call stiffening and hardening of the arteries. And remember, we talked about, if that happens, the blood vessels normally are very pliable and elastic, and so they respond to our different body positions, they respond to stress levels, they respond to exercise intensity. So if our pressure is increasing, perhaps because we're exercising, the blood vessels then can just relax to kind of keep the blood pressure within normal range, so things do not become too elevated, and then we run into to issues. So aging can cause those those blood vessels or those pipes that supply the body to become hardened and very stiff and not flexible, and that can increase our blood pressure. Smoking contributes to high blood pressure because it really speeds up the rate at which this hardening of the arteries happen. High cholesterol actually can contribute to this as well, because it may start not only creating inflammation and causing hardening and stiffening of the arteries, but it can start creating inflammation that may narrow the arteries. And when you try to push the same amount of liquid through something that's narrowed, of course, that can become a problem. A good cholesterol is our body's natural kind of rotor-rooter system. So oftentimes it can just clear out a lot of that sludge for us. That's why knowing your good cholesterol is so important. Some of the foods we eat can actually hasten that development of high blood pressure. So if we're eating processed meats, and I know we tuned in a little earlier, you heard me talk about processed meats and increasing the risk of colon cancer or colorectal cancer, it can also increase your risk of developing high blood pressure as well. People with diabetes are more at risk for developing high blood pressure because that diabetes can damage those blood vessels that the blood flows through. And then that can increase our risk of high blood pressure. A sedentary lifestyle or sitting too much has actually been linked to an increased risk. So not getting enough exercise can actually increase our risk of developing high blood pressure as well. And certain medications, of course, can also contribute. So things like, this is really allergy season. There's a lot of allergies, and many people use decongestants to help with that stuffiness and that nose running all the time. And so they may have an antihistamine with a decongestion, and that can cause the blood vessels to be narrowed and become less pliable and can increase your risk of high blood pressure as well. So certain medications can increase your risk of high blood pressure. Steroid medications that's often used for inflammation, it also can contribute to high blood pressure. And of course, there's some genetic predisposition in certain individuals that may make it easier for them to develop high blood pressure. So those are some of the things that can contribute towards your blood pressure not being in the range that you want it to be. And remember, we want it to be that way because we don't want the organs to get damaged from too much pressure flowing through the system. And also, we don't want those blood vessels to burst from too much, again, too higher pressure flowing through the system. So as you can see, it starts becoming really important, but at the same time, we need enough pressure and blood flowing to those organs to keep them well nourished and well oxygenated, okay? So that's some of the things that can contribute towards high blood pressure. And this high blood pressure affects millions and millions and millions of people, and we're starting to see it in people who are younger, believe it or not. And that may be, of course, because of some of the things that we mentioned before. And one of the things that I did not mention that is also a contributor is elevated stress levels. Elevated stress levels can contribute towards high blood pressure. And there's something called a white coat syndrome. And that's basically what that means is that some individual gets so stressed out when they go to the doctor and they see that white coat and they know that they're going to get their blood pressure checked, that their stress levels go up, the adrenaline in the system goes up. And so you get that. What adrenaline does, it constricts the arteries, and so the blood pressure can go up. And so those individuals, many times when they go into the doctor, their blood pressure is really elevated. But sometimes at home, when you check it, when they're in an environment that is not stressful to them, the blood pressure could be normalized. But this is what I say, you want to make sure, or as much as you can, that your blood pressure is relatively within the normal ranges throughout the day. Now, it will vary, of course, depending on your activity level, but it really needs to be within a certain range for most of the day. So if you're living in stress constantly and you're someone who is predisposed to white coat syndrome, keep in mind that you probably are running around with high blood pressure all the time because your stress levels are high all the time. And the reason that your blood pressure is elevated at your doctor's office because it stresses you out at your doctor's office. So if you're walking around surrounded and bathed in those stress hormones all the time, your blood pressure will be elevated a significant amount of the day. And it's the chronic exposure to that elevated pressure that can lead to damage and significant damage. So we can damage to our eyes and it can affect our vision. It can affect our kidney function so that we may even need to be on dialysis because it can significantly damage the kidneys. It can damage the heart and the heart muscles, and the heart won't pump as well because the muscles get so enlarged because it's struggling to pump against all of that pressure. And so that this is the heart muscle is one of those muscles that you don't want to get too big, right? So when you're building your biceps, great, kudos for you. You know, you're building the gluteus maximus, great. Those can be nice and big and rounded. But the heart muscles, you don't want to get too enlarged because that doesn't leave enough room for the blood that needs to come into the heart to get pumped out to other areas of the body. So high blood pressure can cause that issue with the heart. It can cause issue with the lungs. It can cause issues with almost any system that you can think about. The brain, and one of the things that can happen, of course, it can increase your risk of strokes because it can narrow the arteries in the brain, but it can also causing brain bleeding. So you can have a bleeding, a ruptured blood vessel in the brain, and that is then called a hemorrhagic stroke or a stroke that's caused by bleeding in the brain. So as you can see, high blood pressure, while the end results can cause significant issues that can be identified by labs or by symptoms, initially, many times, we don't have any symptomatology. So we may not have headaches. Some people may have headaches. Some people may have changes in their vision. But oftentimes, most people do not identify a symptom when their blood pressure is elevated. So oftentimes when people feel that I'll take my blood pressure medicine, when I feel that my blood pressure is elevated, please be aware that you may not feel always when your blood pressure is elevated. So it's important to monitor it at home. So you can use one of those cuffs, of course, that can monitor it at home. That's easily found at your closest pharmacy store or drugstore, or many supermarkets also have machines that you can readily check your blood pressure levels there as well. So these are just easy ways to monitor your blood pressure. Now you know that it's important to monitor it, because do not depend on feeling symptoms, because maybe one of the first symptoms you might feel might be a stroke, and at that point we know that the blood pressure has been elevated for a significant amount of time, and so we want to be able to manage beforehand, because this is ultimately what we're talking about, right? We're talking about prevention and early intervention, and as all of our grandmothers probably said, an ounce of prevention is a whole lot better than a whole pound of cure. So that's what we're basically talking about when we meet on Wednesdays at 7:30, is things that we can do and for early intervention and for prevention. So what are some of the things that we can do with high blood pressure? Okay, so let's say you go to your annual doctor's visit and your doctor says, your blood pressure seems to be a little bit high today. So we might want to start monitoring it to see if it is indeed high like this all of the time. So, because sometimes you can go into your doctor's office, it might be 130/85 or 140/90, but again, that might be a stress response. So ultimately, what he or she might say is, let's monitor your blood pressure at home, and let's see what changes we can make to perhaps see if we can start improving that blood pressure, get it to be more consistent. So lifestyle tip number 1, activity levels. So just get up and walk. don't sit for a prolonged period of time, because remember, that's been associated with blood pressures being elevated, probably from this sitting position and also from lack of exercise. Regular exercise has been shown to decrease blood pressure, right? And so that is absolutely walking definitely counts. So, if you're going to the supermarket, you're going to the gym, park far away, count your steps. Maybe you might want to invest in one of these numbers, just to kind of compete with yourself, not others, to see how many steps and how active you might actually be. You don't have to go to the gym as part of an activity level if that's not your thing. If that's your thing, by all means do that. But if it's not your thing, there's so many other things. Find an activity that you enjoy and do that. Find some friends that you enjoy doing it with and do that. The other thing is our diet, right? So we talked about dietary things that we can do. So we want to avoid trans fats and we want to avoid processed foods because, again, they can lead to high blood pressure. And so you want to make sure that you have healthy fats, and you want to make sure that you have foods that allow the blood vessels, because the lining of the blood vessels creates its own chemical. It's called nitric oxide that allows the blood vessels to relax, right? And so that's what nitroglycerin does. If you're having chest pain and you go to the hospital, they give you nitroglycerin. It creates nitric oxide that causes blood vessels to relax and allow blood flow to go back to the heart, and that might improve the chest pain. So there are foods that naturally do that. So those are the foods. So high vegetable content, yes, absolutely. Certain foods such as beets, I have to admit, not one of my favorites, but actually has been associated with creating a decent amount of nitric oxide that can help blood vessels relax. Celery has also been associated with healthier blood pressure levels. Ginger, who doesn't love ginger in a smoothie? I certainly do. Ginger in my tea, absolutely, does help. So when you want to do those brightly colored vegetables, again, because they might help the blood vessels to relax. And then certain amino acids, such as arginine, so the body takes care. These are essential amino acids. So what it basically means that we have to have that in our diet, because the body cannot make it on its own. So this is why the diet needs to be well balanced, okay? So those are some of the things that that we can do. And again, I talked about smoothies, and I do feel that that's a great way to get many of the nutrients that you need that can help you with so many different improvements in lifestyle, right? So next is stress management, because we talked about when the stress hormones are running around in the body and tightening up the blood vessels and causing them to clamp down and not be able to relax. So we want stress management because that's super important. How you manage stress is important. Now, things like yoga and meditation and prayer have all been associated with healthier blood pressure levels, but so has breathing. Breathing is so important. And I'm always reminded when I do one of these that how important breathing is. Now, if you remember a while back, I believe I might have been the two sessions before where we talked about that that little device that was studied that was shown to lower blood pressure simply by learning to train your the muscles that helps you to breathe in. But I think what it basically also does is forces us to take deep breaths, because I can't tell you, and I've become so aware of this, that when I'm interacting with people, just simply observing them, I notice how shallow our breaths are, and that is really not good for stress management, because that gives the body the idea. That's how we breathe when we are alert and we are in that stress mode, we're in that flight or response mode, because we're getting ready to respond to something that could potentially be dangerous. But if we're going around in that mode all the time, then that gives the body the impression that it should have those kind of stress chemicals out all the time, which is not good for our bodies. And another little tip, so people always ask me, what kind of supplements, and I always say there are no supplements that substitute for a healthy lifestyle foundational changes, of course. But there's, things like grapeseed extract, which again helps to bond the blood vessels to create that relaxing chemical that helps it to relax. But you have to do all of these things in combination. And the other thing is that if you're on a blood pressure medication, if your doctor has put you on a blood pressure medication, oftentimes I'm asked, well, can I stop this medication? And I say there's so many things that need to change before then. You need to be aware what your blood pressure is. And so remember, you can't take the blood pressure medicine when you feel that your blood pressure is high, because oftentimes you may not feel that it's elevated. So oftentimes, if you've made some lifestyle modifications and they're starting to work for you, then please discuss with your doctor about the possibility of reducing that medication. Don't recommend that you suddenly stop any medication, because there's certain medications that have what we call a rebound effect. So if you're on those medications for a long time for your blood pressure, and you decide to for whatever reason that to stop it suddenly, that may cause just a reactive higher blood pressure level, and that can really be problematic and can cause more issues than you could ever imagine. So please don't ever do that. If there's some blood pressure medications that are causing you some side effects, please discuss it with your physician as opposed to stopping it. And sit down and have a conversation with him or her and say, and explain what the side effects are and what you don't like about them. And together you can possibly come up with some things that may work. And again, there's some supplemental things, but be aware that some medications and some supplements can interact with each other. So that is not something that you should do lightly, and you should be aware when you're adding, let's say, any kind of supplemental changes or vitamins into your regimen and you're on a medication, be sure it's okay with your doctor or with with a physician who is knowledgeable about such things. Okay? Again, this is creating a healthy thing for you. So it's very personal. Your thoughts and opinions matter, and how your beliefs also matter. So all of these things go into effect when making a decision about what to do about about blood pressures being elevated. Okay, so my first thought is always lifestyle modification. So if you smoke, please stop immediately. If you need help, absolutely speak with your physician, or there's smoking cessation programs that are available to many communities. Look into that, because the blood vessels can recover when you stop smoking, because smoking again can elevate fat. And again, if there's one thing you can do is reduce as much as possible the processed meats and processed foods, as they can contribute towards high blood pressure as well. So that's a little bit about high blood pressure. I always want to keep these short so that you can get some information, but not too much information that it's overwhelming. And this is a point where I will start just taking questions to see if you have any questions about this. It's one of those things that I see oftentimes in my practice, and there's so many reasons. Oftentimes, of course, it could be medical reasons that your blood pressure is elevated, and so super high blood pressure, so oftentimes your physician will probably do things like ultrasounds, and to make sure that there are no unusual things going on in the kidneys, and he or she will also check to ensure that there's no significant damage that has been done by the blood pressure. So there's usually, again, some workup, but this is just a foundational discussion about high blood pressure. So let me take a look and see if there are any questions, and then we will be able to jump right into that. Okay? I want to take this opportunity to say hi to everybody as well. So hi, Mrs. Rogers and Mrs. Lynch. Good to see. Thank you guys for joining me. And Latina, This is really, I'm glad that you were able to join. And Nadine and Adrian, hi to everybody. And Victor, hi. Happy that you're able to join us. And let's see if there are any questions here. And oh, thank you, Fina, for joining us as well. And Marilyn, yes. Okay, so let's see. So a question here is that can exercise actually elevate your blood pressure? In some individuals it can, and the type of exercise, that's why it's important. One, to check with your physician to make sure exercise is okay for you, make sure your heart's in good shape for exercise. And then if your blood pressure is not under control, you definitely might want to avoid lifting significant weights, as that can possibly increase blood pressure as well. So you might want to start with some walking exercises, adding light weights, trying to get your cardiovascular system a little bit more healthy, some water aerobics if you have joint problems, just start getting the body moving. Exercise also can help the blood vessels themselves produce that relaxing chemical that we talked about before. So again, check with your doctor to make sure it's okay, and then get moving. Avoid the super heavy weights initially, and work with him or her to make sure that your blood pressure is coming into a normal range. But absolutely great question about exercise, because it's a very good question, because there's certain times that we can exercise with too much intensity and for too long a duration, and that can sometimes actually do more harm than good. So very good question. I love that one. Thank you. Okay, let's see. All right. So I don't see any questions, and if I'm missing anything, please. Oh, can high blood pressure be reversed? The answer is yes. It does, and by reverse, again, like we talked about, you cannot put the body back in the same environment that created the issue in the first place. So oftentimes when we gain weight, our blood pressures can go up, but losing about 5 to 10% of your body weight can oftentimes cause the blood pressure to go back into normal ranges. So depending on what is contributing towards the high blood pressure, it can absolutely be improved with lifestyle modifications, but those lifestyle modifications have to stay in place. So that's why you want to develop ones that are comfortable for you, that you can do on a daily basis, and avoid fads as much as you can. I know some of you have heard about the DASH diet, so hypertension. And again, look into that. The DASH diet basically, that's what we're talking about. So be limiting sodium for those who are sodium sensitive. You want to make sure your potassium levels are normal. So you want to have foods that are good in potassium and high in potassium, because potassium helps to keep the blood vessels, the blood pressure within the normal range, and kind of balances out sodium a little bit. And you also want to make sure magnesium levels are good as well, because magnesium is a great relaxer of blood vessels as well, and can help to support normal blood pressure levels. So those are things that your physician will probably be looking into to see if there's anything that really needs to be adjusted. So absolutely, high blood pressure, again, depending on the cause, is absolutely modifiable for sure. Okay, let's see if we have any more questions. I believe that is all the questions that I see. If for some reason I'm not seeing your question, I apologize for that. Let's see. Okay. Yes, certain foods can absolutely elevate your blood pressure, like we talked about before. You want to avoid processed foods. and because those are usually super high in sodium content, but they're also very low in nutrients, and they also have compounds in them that interfere with the blood vessels' ability to relax when it needs to, and so it can lead to more stiffness of the arteries, and that can contribute towards high blood pressure. So processed meats are one that you need to eliminate. So when you pick up something, I want you to kind of flip it around, and if there's like a million ingredients and you can't read them, it's probably not great. So anything that says trans fat, out the window. You don't want your sodium content to be too high. Even the people who are more salt sensitive than others, for sure, but most of us don't really need to be getting 5,000 milligrams or higher of sodium in our diet, because again, that can have a negative impact. So there's certain foods that can contribute. We want to keep our foods as simple as possible. So here we're talking about vegetables. We want to keep our healthy fats in our meats. We want to keep our fiber really good as well, and we want to keep our diet as unprocessed as possible. And so, the DASH diet, the Mediterranean diet, those are two really good way of eating that has been really shown to help to improve blood pressure and numbers. So let's see if we have any more questions here. And I think that might be all the questions that we have for today. And I'm so glad that everybody joined in. And if you have a specific thing that you wanted to know, again, please feel free to reach out and ask those questions. If there's something that you wanted in particular that I did not touch on, I'm usually happy to talk about it again within a short period of time. Wanted to give you as much of information that will help you to make a decision so that you can know what your next step is going to be. Okay, and so next week, what I wanted to talk about next week was why it's important to remove toxicity from your environment for health. And toxicity comes in many forms. Okay, so we're not just talking about toxic things such as pesticides and herbicides, etc. We're talking about perhaps toxic environments, toxic individual, because the reason is that we very seldom can heal in the same environment that created the illness in the first place. So we want to talk about some of the impact that toxic things can have on your health, and perhaps some simple ways to help to identify what's toxic in your life, and simple ideas about how to seek help to remove some of those toxicities from your environment. Okay, so that will be next week. So if there are no further questions, I will see you next week. I'm just going to take one final look, and if there are no further questions, then absolutely tune in next week, and I'll see you then. Let's see. Okay, so see you next week. Thanks for joining me. Bye-bye.